In this video, let's talk about patellofemoral pain syndrome. Hey there, this is Elbu, your exercise physiologist, here to help you better understand your body so that you can improve in your health, fitness and performance. Now, we know that there's actually a lot of knee pain, just so that you're aware of, and there's many different terms that is used to describe the knee pain, such that the professionals, when they look at the name, they know roughly where the pain is. Okay, so when we talk about patellofemoral, it's basically in between these two bones, which is your kneecap and your femur bone, your thigh bone. Okay, so that area is basically easy for us to locate and easy for you to locate, so that you actually know that that is the issue, right? Most people talk about knee pain and they can't really pinpoint, and they just say that it's around here, around there. They can't be sure, and if you don't have a proper check, have it done. But if you really know that this is the spot, then this video is going to be helpful for you. So we're going to talk about patellofemoral pain, and this is also commonly known as the runner's knee. Alright, so if you hear people talking about runner's knee, they most likely refer to this. Not all runners get into this problem. So I particularly and personally don't like to categorize people according to their sports and say that because they are in a certain sports they have this pain. Yes, the chance is higher, but it doesn't necessarily means that whoever plays that sport has that problem, because we have to look more into details how things can happen. But in general, even online articles that you try to find, they are talking about very similar things. So basically, this word is combined by two words. So basically means the patella and the femur. So if we were to look at the anatomy, right? So this is where the knee joint is. Let's not look at the muscle. Basically where and what this is referring to is basically the pain around this area, particularly where the kneecap is and where the femur bone is, hence the name, right? So let's take away the muscle first, right? So basically this is your patella, which is your kneecap, and this is your femur. Okay, so the name suggests that the pain is around this area. Do take note that if you look up online, they say that it's around the knee, and I can tell you, if you are going around the knee, you're going nowhere, because some people, for some patients, the pain can be around here. Some patients, the pain can be around here. Some patients, the pain can be around here, and some people, the pain can be around here, some around here. It does give me a clue to what's happening to the knee, because it means a lot. Okay, so if we were to be more precise, we're only talking about like this area. Okay, and around this area, we're looking at the quadriceps muscle. Most of the time, the pain is contributed by the quadriceps muscle. Okay, it could be weak, it could be overload, right? We will go through in details later on, but basically you need to understand why the name and where is it. And the symptoms over here is rather general. It happens to almost all knee problems. Almost, okay? So the pain can be aggravated when you're walking up the stairs, down the stairs, when you're kneeling, when you're squatting, and when you are seated for a prolonged period with your knees bent. Alright, so like I said, this is very general. It almost captures like 80 to 90% of how the knee pain is. But hang on a bit. I'm gonna help you understand a little bit more later on. Okay, and the causes usually because of overuse. An example of an overuse is, for example, somebody runs for like 6 days a week, and without proper recovery, it becomes an overuse case. Okay, and this is almost linked to the next 2 points. Okay, why we say muscle imbalance and muscle weakness is because if a certain muscle is overused, it doesn't recover well, then you will shift yourself to another muscle, and then there is some sort of imbalance. The movement is usually the movement usually involves a certain muscle, for example, your quads. But because it has been overused, you tend to shift yourself away from the pain, and then you create another overuse problem. Could be the hamstring, could be your adductor. Okay, this can happen. Weakness is because when you tend to overuse and you create the imbalance, and you tend to use a certain muscle more than the other, the weakness then happens because you're not moving in a certain way that you are supposed to move. Okay, so then it creates the weakness for that muscle, and then it becomes a, I would say, exponential kind of pattern. It becomes weaker, and then this become overuse, right? An injury, we tend to look at two things, right? One is acute. That means if anything that happens within maybe 48 hours that causes your knee pain, that is acute because it happens like within, the past 48 hours. It could be even up to a week, depending on what happened, right? The other thing that we talk about is chronic. No acute accident, nothing happened within, the past 48 hours to a week. But this chronic, it's something that it happens slowly. You do not know what happened. You don't know how it happened, but it just happened. And most of the time, it has to do with, again, overuse and muscle imbalance and weakness. Okay? So how do you prevent this? Well, strength training is one of those things that we, or rather I, tend to promote, because if you look at my past video, us as human beings, we tend to get weaker over time. Generally, that means our muscle gets smaller, it loses strength past a certain age if you don't maintain or you don't train enough. Okay, so if you're not doing anything to maintain the strength, you will lose it. Then the loading starts coming. Okay, and then it has to do with the point below, right? Then we also got to look at the movement pattern and the technique, right? This I will show you in the video because it's you can see better, right? Why we focus more on the movement pattern and the technique over here, basically biomechanics, is because if you are supposed to move in a certain manner when you're walking or when you're running, but over a long period of no correction, no change in the pattern to improve how you are running, then it becomes a problem because you're not supposed to move in that manner, and it becomes too much for the body to handle. Okay, so let me show you a video, or rather a few videos. So basically, when we get patients to run, we're actually trying to see how they're running. Okay, speed aside, we're looking for how they're landing and what's like the stride length involved over here. Okay, so for this patient, what we can see is that, if you didn't notice, he tends to land on the heel. Okay, and then after correction, what I want him to do is to try to land at least at the midfoot to forefoot. You can also see that his running pattern, his body position, it's very different already over here, because once you change this, once he knows and learns that he needs to do this, things above change, right? So people sometimes talk about the ankle problem, knee problem, hip problem, lower back problem. If we don't look at this, it's sometimes hard to tell what's causing the problem. So it may be because that he is running in a pattern that we don't want him to, and unless we correct this, he's gonna get, for example, the knee pain over and over again, which happens to this patient. He has got knee pain when he came and see me. So unless we correct this, we're not gonna tell, we're not gonna see the change or the improvement. Okay, and this is from the side view. And if we look at the side view, the back view, he tends to also go into like a, I would say, externally rotated. So you can see that his toes are actually pointing more to the side. This case, it's about maybe 30 degree. I'm not so particular about measuring, 30 degree to 20 degree. What I am trying to get him to do is to, as much as we can, try to point the foot forward. Let me see if we can. Okay, he is still in the middle of trying to, get himself internally rotated. It takes time. Okay, there's no quick fix to this, because apart from learning what to do, I'm actually training the weaker muscles to work properly, so that he is not consciously thinking too much about trying to point his foot forward. He basically just needs to concentrate on shifting his body weight such that he's landing on his midfoot or forefoot, not so much on the heel. Okay, so that's what I was trying to do actually. Now, if you have found the video helpful, don't forget to smash the like button. This way, YouTube will also promote my video to other people who may find it helpful. Don't forget to also subscribe and to hit the notification button. This way, YouTube will let you know when I post a new video. Back to this. Usually, you also hear people talking about overweight. There's a correlation with strength, because, for example, if you are weighing 70 kg, right? And if you have not been maintaining your strength, 70 kg may be too much for you to handle, right? Let alone going into 80 kg, 90 kg, 100 kg. Okay, strength comes from training. It doesn't happen like, with a snap of a finger. And which is why a lot of people, they tend to go the opposite route. Instead of increasing strength, they try to decrease the weight if the patient is overweight. Okay, but however it is, being overweight does increase a lot of risk, getting into different chronic diseases. So it's good to also bring down the weight, but particularly knee pain, there is that link over there. All right, so coming to exercises, you need to make sure that you are warming up properly and you are cooling down properly. And when I say cooling down, it has to do with stretch, not just after your workout. So this, I mean after the workout, but this stretch over here means that you got to do it throughout the day, like a few times a day. Okay, so that's warm up, cool down, and stretch. We'll go through the stretch later on. Particularly, that helps with this current issue. And then we also have the intensity control. For example, if you are running at 8 kilometers an hour speed, you want to increase your intensity. You don't want to increase such that there's a big jump. You are doing 12 kilometers an hour. That's not realistic. Okay, so you don't increase it in such a manner. Another example, if you are lifting like 60 kg, right? It could be squat, it could be deadlift. You don't want to suddenly increase the weight such that you are lifting 90 kg. That's not realistic. Okay, so if you increase your intensity so much, it's gonna make your knees feel painful, right? So what do? Right, so you can rest, ice, and use heat. Okay, rest, obviously you know what to do. Icing and heat, you need to know what to do, and I'll show you in the video. Right, basically what I need you to do is, if you're feeling pain at this moment, and if you don't know how to tell whether it's because of inflammation, I just want you to ice around the knee. Okay, I do not have an ice pack with me. I'm using a towel to show you what you're supposed to do. Okay, basically you can put the ice pack on your knees. You can use another towel to put it on top of this ice pack and hold it there for about 10 minutes. That's for the knee joint. Okay, and then when you want to use the heat, what I need you to do is I need you to put this on the muscle itself. Okay, putting it on the muscle helps the muscle to relax. Okay, this heat pack, ice pack could be the same thing, just that it's different temperature, and I want you to use it on different area of your knee and your muscle. Do not mix it up. It can make your condition become worse. Okay, so you need to take note of that. Just need to be careful. So 30 seconds for this icing, 10 minutes for the heat. Okay, please do not burn yourself. Please do not scar yourself. You want to put something thin, like a clothing or towel, so that the heat can slowly get through the skin and to the muscle. Basically, I just want it to be warm. I don't want it to be hot. Okay, so release of the muscle, basically you can do it on yourself. I'm going to show you some of the techniques that I help patients with, and you can do it on your own for this particular problem. Okay, I just want the muscle to relax. Basically, this releasing of the muscle and heat, they both have the same effect, which is to get the muscle to relax, but they work differently. Okay, they work differently. So one is we need the temperature's help, one is that we need you to be manually doing it for yourself, and all I need you to do is just hold it there for a while, and you can use your palm, sorry, not your palm, your wrist, okay, and you can use your elbow and to hold it there for a while. Alright, and the last thing, I know this, for some people they are not accessible to therapies, and hence they can't go for therapy, so you can do this too on your own, but therapy, you really need to see someone and find someone to guide you and to do it properly. Okay, so things that you can do now, basically what I have shared with you on the previous slide. The last one over here is a stretch, and basically I want you to do the stretch in this manner. Okay, so this is what I need you to do. Basically, it's just to use a towel and put it on the floor and to do a quadricep stretch. And if you can't do it on the floor, alternatively, you can also use a chair and to do similarly. Okay, each stretch, you're going to hold it there for 30 seconds, and you can do it multiple times a day, preferably 3 to 5 times. So what do you do next? Basically, I need you to closely monitor what's happening to your knee pain, right? What is it causing the pain? What are the things that you have been doing that aggravates the pain? This helps a lot with your condition. And if you were to see somebody, a professional, a physio, a doctor, he or she should be able to use the information, if they know what to look out for, to help you. Okay, which is also what I meant by, be more aware of your lifestyle and your habits, because this really tells me a lot, right? Whether you are feeling pain up the stairs, down the stairs, whether you are feeling it while you're doing a squat, which phase is it? That means whether you are squatting down or whether you are coming up from a squat, it does give me a clue to what's happening. All right, so like I said, see a professional if this problem is happening again and again, or it's worsening, because you most likely don't know what to do to help yourself. Okay, so please see a professional. Okay, so basically that's all I have for you in this video. For most part of knee pain, if it started happening, my suggestion is not to delay, because the longer you delay, you don't know what to do. Most of the time it will also land up with you getting yourself an imaging, and then after that start to see something in the knee itself. Okay, so please be honest with yourself. Don't torture yourself. Don't delay this, because the faster you get it fixed, the faster you go back to your sports or your lifestyle, or as in what you are doing usually. The longer you delay, the worse it can happen. Okay, so that's all I have for you in this video. Please take care. See you in my next video. Bye bye.